ado, I'm really pleased to introduce the Minister for Mental Health and Wellbeing, Sarah Murphy. Thank you for joining us today.
Bore da pawb, and good morning to all. Thank you so much for that brilliant introduction. It is an absolute privilege to be here today to open the Public Health Network Cymru conference, Building Strong Foundations, Enhancing Mental Health and Wellbeing for Babies, Children and Young People. In the 3 years before I went into government, I was on the Health and Social Care Committee and the Equality and Social Justice Committee, so there's some familiar and new faces here today, but a lot of the work that you've all done has always fed into that, and it was one of the things that was always in our recommendations, that we needed to have more of a focus on babies, children and young people, and particularly their mental health and the inequalities. There will be plenty of opportunity throughout the day to listen and reflect on a wealth of knowledge from NHS staff, government advisors and researchers alike, and how we can collectively improve outcomes for babies, children and young people. And I really want to thank all of you for coming today. It really does show the commitment we all have to ensuring a strong start for our future generations, and it is an area which I am personally very committed to. I understand this is the first time you've all met together in person for a while, so I think that's really important to be able to kind of talk openly and have those networks and connections with one another. And co-production, I was just talking to Nicola now about this. I've heard many times actually from people who work both, well, across all of the nations, but particularly between England and Wales, that we do co-production really well in Wales. We've really kind of embraced that absolute necessity for the lived experience and for that view. So I'm really proud always when I hear that. It's not quick or easy doing really meaningful co-production, but I think the outcomes are so much better. And all of this that you're doing today is a huge part of that, and I very, very much appreciate it. So in that light, we're going to be producing the new strategy for the mental health and wellbeing strategy and the delivery plan for it shortly. And the delivery plan will include our priority actions for the next 3 years. And it really has been done with a huge help of our stakeholders and the public responses to the consultation that we published last year. I know many of you here today have been involved in helping us draft the strategy and the delivery plan, for which again I am extremely grateful. It is also vital that we learn from lived experiences, and hearing everyone's voices is essential to shaping policy. This is no different when considering the needs of babies, children and young people. Therefore, as part of our engagement around the mental health and wellbeing strategy, we have heard from over 400 children and young people. They told us they wanted support that is flexible and responsive to the specific needs of each and every individual. Children and young people talked about the critical role of schools in supporting mental health and wellbeing as opportunities to play, to connect with one another, and to form strong and supportive friendships and connections with their peers. Young people tell us that schools are central to supporting their emotional health and well-being, and we have made a considerable investment in developing and implementing the whole school approach since its inception. And I'm sure many of you are aware that Cabinet Secretary for Education, Lynn Neagle, is very much driving this forward as well. In 2024 and 25, we made available £13.6 million to support implementation of the whole school framework and programme of work. And recognising the importance of this support, both the Cabinet Secretary for Education and I have maintained this level of support in the Welsh Government draft budget that was going through at the moment. This includes £4.75 million within the Local Authority Education Grant to extend and improve the current school and community-based counselling service to deliver universal and targeted wellbeing interventions, and for the training of teachers and other school staff. And £5.6 million to ensure continued support from local health boards in Wales to deliver the National CAMS School In-Reach service, which sees dedicated mental health professionals in our schools. At mid-February, nearly 1,100, so 74% of all schools are actively action planning around their wellbeing needs, and secondary schools are making more progress with 96% action planning compared to 70% of primary schools. Only 9 secondary schools are not yet in the action planning stage. The children and young people also said the strategy must acknowledge the vital role of young people's families in protecting and supporting their mental health and well-being, and ensure young people's parents and guardians are better equipped to understand and effectively support them. Our NIST Nest framework, which I understand you'll be hearing more about later on today, responds directly to the asks of the children and young people who we engaged with. Our new mental health and wellbeing strategy will reinforce the importance of the key principles of NIST. However, the ambition of a whole school approach to mental health and wellbeing will only be achieved if every part of the system comes together with a shared purpose. I would therefore urge you to use the NIST implementation tools available on their website, including the self-assessment tool and training. Early relationships, we know, are fundamental to infant mental health and create the foundations for positive development throughout childhood and adolescence. Our new strategy will also reinforce our commitment to strengthen support for perinatal and parent-infant relationship work in Wales. And I'm very happy to see us collaborating together with a shared ambition to deliver this important programme. I encourage you all to take part in the open space sessions this afternoon. Co-production is essential in driving forward our shared vision for better mental health for all. So I am extremely grateful to have had the opportunity to open this conference for you today and to highlight our commitment to protecting and improving mental health and well-being for babies, children and young people in Wales. And now I have to apologise because I'm going to be one of those politicians that does breeze in and breeze out. And I'm very, very sorry for that. I assure you I have lots of meetings, back-to-back meetings for the rest of the day, which are absolutely driving so many of these areas forward in women's health and in mental health. But I wanted to say that I really think that the research and innovation sessions this afternoon, I've seen the topics. I'm so looking forward to receiving your feedback on them, especially the work around secondary schools. I hugely welcome all of your views on this and want to kind of work forward in seeing them. And I just wanted to say that I think the agenda is fantastic. And I know this has taken a lot of effort to coordinate, but I think bringing people together is really, really important. So it's really lovely to see you all. And I hope to get to see you all again and speak with you more. But I hope you have a really, really good day. And I thank you all for being here. Diolch yn fawr.